Hi, welcome to Chapter 5, Sudden Illnesses. Asthma. People with asthma have highly sensitive airways that become inflamed easily. Asthma episodes or attacks occur when something bothers their airways. The same substances called allergens that cause allergy symptoms can trigger an asthma attack. And there are two types of asthma medicines, quick relief or long term. So, what to look for? Frequent coughing, wheezing, breathing difficulty, unable to speak in complete sentences without stopping to breathe, sitting in the tripod position, that's leaning forward with hands on knees or other support, trying to breathe. What to do? Help a person experiencing an asthma attack use their physician prescribed inhaler without a spacer. Take the cap off the inhaler and make sure the mouthpiece and spray hole are clean, and you shake the inhaler 10 to 15 times. Without the inhaler, ask the person to take a deep breath and then breathe out all the way. Have the person hold the inhaler upright between their index finger and thumb. Have the person put the mouthpiece of the inhaler in their mouth, above their tongue, and between their teeth, and then close their lips around it. Have the person start breathing in slowly, then press down on the inhaler once while breathing in all the air they can. Then you tell them to hold their breath for 5 to 10 seconds with their mouth closed. When the 5 to 10 seconds are up, tell the person to open their mouth and breathe out slowly. If the person needs another dose of medicine, wait 1 minute before repeating these steps. Help a person experiencing an asthma attack using their physician prescribed inhaler with a spacer. Spacers are more commonly prescribed for children. Take the cap off the inhaler and make sure the mouthpiece and spray hole are clean. You want to shake the inhaler 10 to 15 times and insert the inhaler mouthpiece into the end of the spacer. Have the person hold the inhaler and spacer between their index finger and thumb. Then, without the inhaler, ask the person to take a deep breath in and then breathe out all the way. Have the person put the mouthpiece of the spacer in their mouth above their tongue and then close their lips around the spacer. Have the person tip their head back slightly towards the ceiling and press the top of the inhaler to spray 1 dose of medicine. Tell the person to slowly breathe in all the air they can and hold for 5 to 10 seconds with their mouth closed. When the 5 to 10 seconds is up, tell the person to open their mouth, move the inhaler away from their mouth, and breathe out slowly. If the person needs another dose of medicine, wait 1 minute before repeating these steps. Call 911 immediately if the person is struggling to breathe, talk, or stay awake. If they are unable to speak more than 1 or 2 words in one breath, their lips or fingernails turn blue, the person asks for professional medical care. If there's no improvement after using their quick relief inhaler, or if they do not have a rescue inhaler, if repeated attacks occur, or a severe and prolonged attack occurs. Anaphylaxis. Anaphylaxis is when the body overreacts to allergy triggers and releases chemicals to protect itself. A severe allergic reaction occurs. That's called anaphylaxis. Epinephrine is a medication that can stop severe allergic reaction. If it is available through a physician's prescription, it can be self-administered using the epinephrine autoinjector, most commonly known as an EpiPen. Most allergic reactions do not require epinephrine, but a small portion of reactions can progress to life-threatening anaphylaxis. So, anaphylaxis, what to look for? That is swelling of the lips, tongue, mouth, and nose, swelling, itching, difficulty swallowing and speaking, skin symptoms, swelling around the eyes, flushing, severe itching, breathing, so that's trouble breathing, coughing or wheezing, cramps, nausea, vomiting, unresponsiveness, and that person may have a medical identification tag. What to do for anaphylaxis? Call 911 immediately. The effects of an epinephrine from an auto-injector will wear off. Ask the patient about any severe allergic reactions and look for and ask about a medical identification tab. So figure 5-2, left an EpiPen auto-injector intact before use. Center, the blue safety cap is removed. Right. After injection, the orange cover automatically extends to ensure the needle is never exposed. Several other brands of epinephrine auto-injectors are available, and they may be in different shapes, different colors, different forms. So it's good to familiarize yourself. If the person has their own medically prescribed epinephrine auto-injector, they will usually know when and how to use it. If the person asks for help and your state law allows giving an injection, use their prescribed auto-injector, and you need to stay with that person until EMS arrives. Do not inject another dose of epinephrine immediately after the first one. You want to wait 5 to 10 minutes. If the person does not get better 5 to 10 minutes after the first dose, or EMS arrival will exceed 5 to 10 minutes, consider giving a second dose if you have a second injector. About 20% of people receiving a first dose will require a second dose. And when in doubt, administer a second dose. If there's no signs of breathing, call 911 if not already done and begin cardiopulmonary resuscitation, CPR. If there is not an epinephrine auto-injector available, use an asthma inhaler or nasal decongestant spray. And if the person can swallow, give an antihistamine like Benadryl as directed on the label. These are not life-saving because they take too long to work, but they can help prevent further reactions. And you want to monitor until professional care arrives. Now, mild allergic reactions. What you want to look for is red, itchy eyes, itchy, sneezing, stuffy, or runny nose, a rash on skin, itching, usually on one part of the body. What to do? Self-administer their asthma rescue inhaler and or give an antihistamine. Heart attack. A heart attack happens when the blood supply to the heart muscle is suddenly reduced or blocked. If the blocked artery is not reopened quickly, the part of the affected heart begins to die. The longer a person goes without treatment, the greater the damage to the heart muscle. What to look for. Although sometimes it can be difficult to determine, symptoms of a heart attack can include chest discomfort that feels like pressure, squeezing, fullness, usually in the center, sweating, lightheadedness or dizziness, nausea or vomiting, numbness, aching, or tingling in an arm. It's most often in the left arm, shortness of breath, weakness or fatigue, especially in older adults. Women and older adults are more likely than men to have milder symptoms of a heart attack that can extend over many hours, days, or even weeks leading up to the heart attack. That's shortness of breath, nausea or vomiting, an ache in the chest, sore jaw, strange feeling in arm, upper back pain, flu-like symptoms, and dizziness. Have the person sit with knees raised and lean against a stable but comfortable support, for example, a wall, a tree trunk, or fence post. Do not allow that person to walk. Doing so can put more stress on the heart. You try to keep that person calm. Call 911 immediately. Do not drive the person to a medical facility. Wait for EMS to arrive. And while you're waiting for EMS to arrive, you want to loosen any tight clothing. Ask that person if they take any chest pain medication for a known heart condition, and if so, help them take it. If the person is alert, able to swallow, not allergic to aspirin, and has no signs of a stroke, help the person take one adult aspirin or 2 to 4 low dose aspirins. Pulverize or have that person chew them with their teeth before swallowing for faster results. Monitor breathing. If the person becomes unresponsive and stops breathing, begin CPR. If they are unresponsive and they are breathing, you place them on their side in the recovery position. Stroke. A stroke happens when a blood vessel in the brain bursts or is clogged. And without oxygen, brain cells in the affected area begin dying within minutes. Because brain cells are not replaced, the devastating effects of a stroke can be permanent. And strokes are the leading cause of death. Stroke, what to look for. Use the acronym FAST as an assessment tool. F is for face droops. Ask that person to smile. It is abnormal for one side of the face not to move well compared with the other side. A, arm weakness. Ask the person to close their eyes and raise both arms with their palms up for a count of 10 seconds. It is abnormal if one arm drifts downwards when held extended. S, speech difficulty. Ask the person to repeat a simple phrase. It is abnormal if the person slurs words, uses the wrong words, or cannot speak at all. T, time to call 911 if any of the preceding signs occur. The presence of one or more of these signs is associated with a high risk of stroke. What to do? Call 911 immediately. Monitor responsiveness and breathing. If the person is unresponsive and not breathing, begin CPR. If they are unresponsive and they are breathing or have fluid or vomit in their mouth, place them on their side in the recovery position. This will allow any fluids to drain out of their mouth. If they are alert, allow them to find a comfortable position with the head and shoulders above the body. Do not give that person anything to eat or drink. The throat can be paralyzed, which restricts swallowing and causes choking. You want to loosen tight clothing and record the time the stroke may have occurred and give it to the EMS personnel. Seizures. Seizures result from a disturbance of the electrical activity in the brain, causing uncontrollable muscle movements. Causes include epilepsy, head injury, brain tumor, stroke, heat stroke, poisoning, including alcohol or drugs, diabetic emergency, and high fever. What to look for: a sudden cry or scream, a sudden loss of responsiveness, rigid body followed by jerky movements with an arching of the back or convulsions, foaming at the mouth, drooling at the mouth, grinding of teeth, blue face and lips, eyes rolling upwards, loss of bladder or bowel control. What to do: move nearby objects to avoid injuries. Place something soft under the head, such as a rolled towel, but you do not want to use a soft pillow. Do not hold the person down. Do not put anything between that person's teeth or give anything by mouth. Doing so may cause dental damage or inhalation of the object. You do want to time the seizures from start to finish. Most seizures do not require professional medical care and can end in 1 to 2 minutes. You do want to keep bystanders away. Call 911 for any of the following: a seizure lasting longer than 5 minutes, a series of seizures following one another, the person has breathing difficulties after the seizure, the person has diabetes or is pregnant, seizure happens in water. This is the person's first known seizure. The seizure is injury related, or they have a slow recovery. After the seizure, you want to keep the airway open by placing the person on their side and head on a rolled towel. Provide breathing control if the person bit their tongue during the seizure. Monitor breathing, and if it stops, give CPR. Allow that person to sleep, and you stay with that person until they are alert again. Diabetic emergencies. Insulin is a hormone produced in the pancreas that helps sugar or glucose enters the body's cells. Diabetes is a disease in which the body's ability to produce or respond to insulin is impaired. Some people do not produce insulin from a young age, and some people lose the ability to produce an ample supply of insulin later in life. Diabetes can be a troublesome disease, leading to an altered level of responsiveness and long-term circulatory and neurologic problems. There are two types of diabetic emergency: hypoglycemia, that's low blood sugar, hyperglycemia, that's high blood sugar. Giving sugar helps the person with hypoglycemia, but not the person with hyperglycemia. Sugar will cause no harm in either condition. Ask the person with diabetes two questions. Have you eaten today? And have you taken your insulin today? If the person with diabetes has taken their insulin but has not eaten, suspect hypoglycemia or low blood sugar. If the person with diabetes has eaten but not taken insulin, suspect hyperglycemia or high blood sugar. So, what to look for hypoglycemia or a low blood sugar? That's shaking, trembling, cold, clammy or moist skin, confused, lightheaded or dizzy, hungry, nauseated, tingling or numbness of the lips, tongues, or cheeks, and heavy sweating. A responsive person may be able to tell what is wrong and what to do. And if the person has a blood glucose monitor and is capable, have them check their blood glucose level. It's the only sure way to know if a person is experiencing low blood sugar. For hypoglycemia, use the following procedure only when testing is not possible and low blood sugar is suspected. Testing shows a low blood sugar glucose level of below 70, and profuse sweating or shaking occurs in a person known to have diabetes. If the procedure is as follows, and if the person can swallow, have the person eat 15 to 20 grams of sugar. If available, 3 to 5 glucose tablets is preferred, as directed on the label. But if glucose tablets are not available, give any form of sugar, such as a glucose gel tube, as directed on the label, 4 ounces or 1/2 cup of fruit juice, like orange or apple juice, 4 ounces or just 1/2 cup of regular soda. Make sure it's not diet soda. 3 to 5 teaspoons of table sugar or honey, hard candies, jelly beans, or gumdrops. And you want to check the food label for how much to consume because they need to eat 15 to 20 grams of sugar. Wait 10 to 15 minutes for the sugar to get into the blood. Recheck the blood glucose level, or if there's no monitor, look for signs of improvement. If it is still low or no monitor was used and the person still has symptoms of low blood sugar, give that person an additional 15 grams of sugar. If there's no improvement or you're unable to give sugar, call 911 immediately. Notes about children. Young children usually need less than 15 grams of carbohydrates to fix a low blood sugar level. For infants, that's 6 grams, toddlers, that's 8 grams, and small children is 10 grams. For a suspected hypoglycemic and uncooperative child who rejects swallowing a form of glucose, glucose placed under the tongue or sublingual can be attempted. Many people may want to eat as much as they can until they feel better, but this can cause blood sugar levels to shoot way up. Use the procedures previously mentioned to help avoid this high blood sugar levels. So, diabetic emergencies, severe hypoglycemia, what to look for. Staggering, slurred speech, and now following simple commands, unable to swallow, seizures, and unresponsiveness. Call 911 immediately. If not breathing, begin CPR. If breathing, roll them onto their side in the recovery position and monitor breathing. Do not give food or fluids. If unsure which diabetic condition, if you're not sure whether it's low blood sugar or high blood sugar exists, give sugar. Do not give insulin. Never give insulin. What to look for severe hyperglycemia or high blood sugar? That is drowsiness, extreme thirst, very frequent urination, warm, flushed, dry skin, vomiting. Fruity breath odor has also been described as to be like nail polish remover, heavy breathing, and eventual unresponsiveness. Give frequent, small sips of water if the person with diabetes can swallow. If possible, have a family member check their blood sugar level. If uncertain whether the person with diabetes has a high or low blood glucose level, and if they were responsive and able to swallow, use the procedures for giving sugar as previously described. The extra sugar will not cause significant harm in a person experiencing hyperglycemia. Do not give insulin unless the person with diabetes can self administer it, and call 911 as soon as possible. And that concludes the chapter for today.